chronic kidney disease. What you must do to help yourself. It's common for people diagnosed with chronic kidney disease to be overwhelmed, because there is a lot of information to take in at once, and a lot of questions come to mind at once. First, we will tell you some facts that most doctors will not tell you, and then end the video with how you can help yourself. The term chronic means that it is a long-term condition, and does not mean that your kidneys are completely damaged, as many cases of chronic kidney disease are mild and can be managed with help from your general practitioner doctor and without hospital admission. The vast majority of patients with chronic kidney disease do not have any symptoms and may not need specialist input in early stage. Chronic kidney disease can get worse over time, and eventually the kidneys may stop working altogether, but this is not common. Many people with chronic kidney disease are able to live long lives with the condition if properly managed. However, it can develop to a more serious stage where the kidneys no longer work. This is called kidney failure. You can contact us via the link in the description below for any medical inquiry. Once a person is diagnosed, the doctor will work out what stage of chronic kidney disease the person have. This is done by measuring the amount of creatinine, a waste product which builds up in kidney disease. Your doctors can use this to estimate how well your kidneys are working. You may hear this referred to as your estimated glomerular filtration rate, eGFR. It is based on how quickly your kidneys are cleaning your blood and is measured in milliliters per minute. It is unusual for kidney function to improve dramatically once your kidneys have been damaged, but it does depend on the cause of the problem. At the first visit to the doctor or your specialist kidney doctor, they will try and find out the cause of your chronic kidney disease. After that visit, each time you go, you will have your weight and blood pressure measured, and a sample of your urine will be checked for signs of blood, protein, or infection. You will have a blood test to measure your kidney function and check for signs of anemia, bone health, and blood acidity levels. You will then speak to the doctor about your symptoms. At this point, it is important to let your doctor know all the symptoms you have. Ask a friend or family member to come with you. Take notes so you can remember. Note down any additional questions or concerns that occur between visits. Ask your doctor to discuss which treatments are available, and be ready to discuss with your doctor to make important choices on how to manage your condition. Let your doctor explain possible lifestyle changes and medication that may relieve symptoms and slow the chronic kidney disease progression. Ask your doctor for possible other risks and diseases associated with your condition, and what are the possible complications. If your kidney function is stable and mild, you will normally be referred back to your general practitioner. You should have yearly checkups to make sure everything is okay, but may not need any specific treatment. There's no cure for chronic kidney disease, but treatment can help relieve the symptoms and stop it getting worse. Your treatment will depend on how severe your condition is. Although it's not possible to repair damage that has already happened to your kidneys, chronic kidney disease will not necessarily get worse. Chronic kidney disease only reaches an advanced stage in a small proportion of people. But even if your condition is mild, it's important to take good care of yourself to help stop it getting worse and reduce your risk of other health problems. You may receive treatment for some of the symptoms of kidney disease, including anemia, fluid retention, and treatment to keep your bones healthy. If you are approaching the later stages of chronic kidney disease, you should start to be given information about the possible treatments available. These include kidney transplantation, dialysis, and conservative management. There are many ways you can help yourself. If you smoke, stop. Ask for help in stopping if you need to. Try to control your blood pressure. Take your blood pressure medications regularly and as directed by your doctor. Reduce the amount of salt in your diet to less than 6 grams per day. Do regular exercise. Maintain a healthy weight. If you are overweight, have diabetes, and need advice on your diet, ask your GP about the services available in your area. They may refer you to a dietitian for specialist advice. Eat a healthy and balanced diet. Avoid anti-inflammatory medicines such as ibuprofen, as they can make kidney disease worse. Ask your pharmacist each time you are given a new medicine to check that it is okay for you to take with your reduced kidney function. Do not stop your medication without taking medical advice. Note that knowledge is advancing by the day, and we will like to always post an update on new advances on how to stay healthy. You can contact us via the link in the description below for any medical inquiry. You are watching Zoom Hospital channel and listening to work of Dr. Kayode.